Hi, I'm Marlee-I, and I am here to introduce you to SisterWeb Community Doula Network, where we are supporting families, mending communities, and transforming institutions. Now, you may be asking yourself, what is SisterWeb? In short, it's a fiscally sponsored project of Haluna Health, a provider of high-quality doulas and client care, and a resource for building strong, thriving communities. A SisterWeb doula is a culturally congruent Latinx, Black, or Pacific Islander, community-based outreach worker and birthing coach. This beautiful figure here really gets to the heart of their work. A doula not only monitors labor progress, but provides physical and emotional support to the birther and partner. The doula also provides valuable information and education from the prenatal phase through those critical first months postpartum. The educational outreach extends to the family and the community, but we'll get to that in a bit. Because of SisterWeb's program methodology, a few key client services include the expertise, support, and advocacy that can only come from a culturally congruent health professional, one who has the ability to build unique and intimate relationships that get lost in the clinical environment, especially when someone has had a previous negative experience or been a victim of cultural bias or systemic racism. Because SisterWeb doulas live in the community where they work, they understand the specific needs of the people in the community, and they can provide them with a robust and full scope of care. In addition to the client services, the program methodology includes doula workforce development. This means professional development and mentoring for each doula, along with outreach within the community to share the value and importance of birth work, stressing that it is an important and dignified way to earn a living. Now, I've given a lot of credit to the methodology, but as you can probably guess, SisterWeb's greatest asset is the doulas, their culturally sound care, holistic approach, and the fact that they reside in the communities where they work. However, you should also know that SisterWeb is committed and devoted to several coalitions and groups that are explicitly addressing racial and ethnic disparities in birth outcomes. Those organizations include, but are not limited to, the California Preterm Birth Initiative, the San Francisco Latino Task Force, and Black Woman Birth Justice and Diversity Uplifts. Additionally, SisterWeb has been able to leverage relationships with medical partners at 5 of the 6 birthing locations in San Francisco by helping to design and implement the Champion Dyad initiative. The Champion Dyad creates support teams at each birthing location made up of a SisterWeb member and 1 or 2 healthcare providers. That can be a doctor, nurse, or midwife. These teams meet monthly to examine cases of Black, Latinx, and PI mothers. The teams provide bidirectional feedback, identify strengths and weaknesses in their care provided, and work to ensure that all women of color receive fair and equitable treatment during their births and pregnancies. In addition to those spectacular features, the organization is data-driven, consistently holding themselves accountable to the community. In fact, recently collected data shows that 90% of the clients report that SisterWeb helped them not only feel more confident navigating healthcare systems, but they now have a better understanding of their rights and options. In addition to holding themselves accountable to the community, SisterWeb also uses data to monitor program goals and successes. We are enormously proud to share that 99% of families who worked with SisterWeb not only chose to breastfeed, but felt encouragement and support from their doula when making the choice. SisterWeb's commitment to evaluate both internal and external performance measures ensures that they are economically empowering communities while simultaneously building strong and trusting partnerships with all stakeholders interested in supporting birth justice. By the time you view this, SisterWeb doulas will have helped more than 100 families with births. In closing, I want to share with you our vision and our call to action. It is our vision that 100% of Black, Latinx, and Pacific Islander birthing people feel heard and respected during birth. We would like to build a workforce of over 200 birth workers. That's 200 doulas by the year 2024. These visions help SisterWeb respond to the overwhelming demand for services in the San Francisco community. The data tells us that this is exactly what we need to focus on: high quality, culturally congruent, respectful care. Now for your call to action. Birthing people in your community, just like in San Francisco, deserve the opportunity to work with the community doula and access this transformative experience. So whether you be a public health professional, an elected official, a maternity care provider, or a philanthropist, we call on you to find a way to help support SisterWeb and other community doula programs nationwide through your political power, your public health work, or your dollars. By doing so, you assist us in supporting families and mending communities. When you partner with us, you help to make life-altering changes to the current healthcare system. Doulas save lives, and they help to lower maternal and infant mortality. Together, with your support, we can transform institutions. Thank you so much.